This week let's talk about COPD and asthma. We have kind of broken these things down by medications, etc., doing practice questions, but this week I really want to delve into COPD and asthma based on the stepwise approach and those four stages of the gold criteria for COPD. You always know that I say this all the time, making sure that you pay attention to ranges, knowing the lowest and the highest end of the scale so that you can easily retain that content when you're going through stuff with detailed steps as far as a stage approach and a stepwise approach, okay? So follow me. I'm going to break it down for you. We'll start with COPD and then we'll go to asthma, okay? Now with COPD, we have four stages. We have a mild, a moderate, a severe, and a very severe stage, okay? That's stages 1, 2, 3, and 4. And we are categorizing these by your FEV1. So that ranges anywhere between FEV1 greater than 80% all the way to a FEV1 less than 30%. So this is where I talk about knowing your high end of the range and your low end, because your mild stage 1 will be a FEV1 greater than or equal to 80%. And then your very severe stage, your stage 4, will be a FEV1 greater than or less than 30%, okay? And then the other two will fall in between. Follow me, we're going to talk a little bit deeper about those. So with COPD, in the mild stage, stage 1, again, the FEV1 is greater than or equal to 80%. So this means that they have some deficits, but not too severe, okay? So it's the mild stage. But with everything, we always have a rescue inhaler. So we have a SABA PRN or a SAMA. And if it's this time of the year during the flu season, we also want to make sure they have a flu vaccination to protect them, because if you already have COPD and a respiratory issue, we don't want to add flu as another complication for you. Now, I do want to put it out there that with the COPD, we can utilize a SABA or a SAMA. Or both in conjunction to, you will see in practice. And the first line therapy are those anticholinergics, which are your muscarinic agents. So you'll hear me say SAMA or LAMA. So you may have a short-acting beta agonist like albuterol or a short-acting muscarinic agent, okay? Now in stage 2 of COPD, which is our moderate phase, we're going to keep on board whichever type of rescue inhaler we have. So either your SABA or your SAMA PRN, we'll keep that on board. But now, because we're on the moderate scale, your FEV1 is following anywhere between 50% and 80%. So if it falls into that range, now we need to bump it up a little bit. So you need more than that rescue inhaler. So we may need a LABA or LAMA in conjunction to that rescue inhaler, as well as we'll keep that flu vaccination on board if it's flu season, remembering that flu season falls from October to March. And then lastly, incorporating pulmonary rehab, okay? All right, so let's talk about stage 3. So stage 3 is a little bit worse. It's the severe stage. So your FEV1 falls anywhere between 30% and 50%, right? So if it's in that category, we already have a SABA or a SAMA PRN for our rescue agent. We have added a LABA or a LAMA for additional coverage. We also have put in, if it's the flu season, anywhere from October to March, they're getting that flu vaccination, and they are in pulmonary rehab at this point. But now we still need a little bit more. So now we're adding in an inhaled corticosteroid, okay? So make sure, even though I'm telling you these groups, I want you to make sure you know the medications that fall into those classes. And we have discussed those in previous videos, so watch those if you need assistance, or follow our group where we have like a breakdown of those. But be sure that you know them. However you recite them, however you learn them, be sure that you're able to identify, even if you see the generic or brand name, which falls into those classes, okay? Now, lastly, we have stage 4 of COPD, which is your very severe stage. The way it is classified for this stage is your FEV1 is less than 30%. So you know how I told you about your ranges? This is that low scale, so you know that you're in the very severe stage. So we already have a SABA or a SAMA as our rescue inhalant, our rescue agent and inhalant on board. We have a LABA or a LAMA that we have extended here. We have issued the flu vaccination or gave them the option for it if it's during that October to March area for the flu season. They are in pulmonary rehab. we have initiated inhaled corticosteroids, but now during this very severe stage, you could also put them on oxygen for life, and they may possibly need surgery, okay? So these are the 4 stages for COPD that I wanted to just break down for you guys to make sure that you're able to identify what FEV1 puts them in the classification and what prescriptions you should start to prescribe. So this is the COPD 4 stages. Follow me for the asthma stepwise approach. Okay, now with asthma, we do the stepwise approach, and we have the initial phase as the intermittent phase. So with the intermittent phase, you will have an FEV1 greater than 80%, as well as they'll let you know that they're having symptoms for less than 2 days a week. So those are the key indicators for the intermittent phase. The way we treat these patients in this phase is that we just put them on a rescue inhaler, which is a SABA, albuterol, for example, PRN. And we do that, and they use it as needed since they're having symptoms less than 2 days, okay? All right, follow me for the next steps. Now, in the mild persistent phase, it's a little bit different. They continue to have an FEV1 greater than 80%, but now they're having symptoms greater than 2 days a week. So they're having more symptoms at this time. So we still keep on our SABA, PRN, like our albuterol as needed. And then because inhaled corticosteroids are major in asthma, we prescribe them with a low dose inhaled corticosteroid. All right. Now in the 3rd stage, which is your moderate persistent stage, all right, so we have an FEV1 falling anywhere between 60 to 80%. They're having symptoms every day now. So we have gone from less than 2 days to more than 2 days that now they're having symptoms every single day, okay? So they've been on this albuterol, your short-acting beta agonist, your SABA, PRN. We've incorporated a low-dose inhaled corticosteroid, and that's not enough. So now that we're in the moderate stage, we want to bump this up a little bit. So if we keep them on the low-dose inhaled corticosteroid, then we need to add in a LABA. We need some extra reinforcement. Or you can choose to just go from the SABA to a medium dose inhaled corticosteroid. So those are 2 options in the moderate persistent phase. Now lastly is stage 4 with the asthma stepwise approach, and this is the severe persistent stage. So in the severe persistent stage, the FEV1 is less than 60%, and now not only are we having symptoms every day, but we're having them all throughout each day, okay? So we have our short-acting beta agonist, PRN, on board as our rescue inhaler. We have our inhaled corticosteroids, so we have maxed it out. So now your options are a medium dose inhaled corticosteroid plus a LABA, or a high dose inhaled corticosteroid plus a LABA, okay? So it's based upon what works for this particular patient. Also, I want you to know that as well as you can step up the stepwise approach, you can step back down. So if we're going through 3-month increments, and with this they have improved, their symptoms are reduced, you can step down the stepwise approach as well, okay? So be sure that you're knowing, you're consistently checking, and you're staying on top of these patients' FEV1 and their symptoms to make sure that you have them correctly treated and what stage they should be on this approach, okay? So this is just a little tidbit on asthma, the stepwise approach. Again, you can see the videos on the medications. There's videos on COPD stages, the 4 stages, the gold treatment options for COPD. And I hope you found it helpful. Follow me for more topics and tips, and share with a friend if you find it helpful, okay? I will talk to y'all soon.